and welcome to the Teachers Lounge Talk Show. I am one of your hosts, Mrs. Piper, and before we get things started, I'm going to ask for our other hosts to introduce themselves, please.
Hello, everyone. My name is Candace Williams. I'm the founder of Irby Education and your favorite reading specialist.
Hello, everyone. My name is Donovan Gardner. I'm a DPSCD special education teacher.
Good evening, everyone. My name is William Weir. I'm a recently retired DPSCD teacher and sit on three different committees for 482 Forward, an educational social justice group.
I think it's important that we understand that we are the Teachers Lounge Talk Show. Hold on, you're looking at our guest here. Hold on one second, please. We are the Teachers Lounge Talk Show, and I want to share our vision statement, and I want to do it through a read aloud. Now, we're teachers here, so all of us are in the classroom except for Will, who is retired. And a read aloud sounds like what it is. We're going to read the text out loud so the listener can hear how the words are pronounced. They could see when the reader makes pauses at commas and periods. So here we go. The Teachers Lounge vision statement. Our vision statement is to provide exclusive information on pertinent educational trends to local and worldwide community members. Our mission statement is to promote all positive aspects of the teaching profession while discussing and debating challenging issues, explaining educational policy, and providing clarity and feedback. That is what we do here at the Teachers Lounge. That's why we're here. Okay, so I just wanted to make sure that we understand that. Now I have the pleasure of introducing our very special guest. You probably have seen this beautiful woman on Good Morning America. We have Dr. Katrina Byrd, and I am going to continue with our read aloud as I introduce her, if you don't mind, okay? We have Dr. Katrina Byrd with us. Dr. Byrd is a pediatric infectious disease fellow at Brown University and a board-certified adult infectious disease physician. Dr. Byrd works with the Lifespan COVID-19 vaccine clinical trials group to increase African American community awareness and participation. She has shared her knowledge on Good Morning America and the Reverend Holly Show here in Detroit. So without any further ado, here at the Teachers Lounge, we welcome Dr. Katrina Byrd. Thank you, Dr. Byrd.
Thank you for having me. I'm more than happy to be here.
Yes. Dr. Byrd, we're just going to jump into the questions. And I would like to know what you would say to someone like me. It seems like you are trying to, I think convince is too hard of a word, but you're trying to inform Black people like myself about the shot. Now, I can tell you that I don't want to be labeled an anti-vaxxer because I'm not. Even though I don't do vaccines, I didn't do the flu shot. I don't want to do COVID shot. And I'm going to explain to you why. My legacy is wrapped up in the Tulsa riots, okay? According to my father, all right, my ancestors fled Tulsa. We're talking about 1921, running for their lives, okay? And the government sponsored the attack. So when I hear a government vaccine, I think my innards, my ancestors cry out from my belly to say, don't do it. They're trying to kill you like they tried to kill us. So what can you say to someone like me who doesn't want the vaccine for no medical reasons? I have beef with the government. So what do you say to someone like me?
So first of all, I thank you for sharing your story. Unfortunately, many African Americans, Black and African Americans, share similar trauma when it comes to the healthcare system and the United States challenging past in regards to treating people fairly when it came to doing clinical trials, namely the Tuskegee experiment. So I definitely just want to acknowledge your trauma and your pain, and I definitely appreciate you letting me know about that. I think for you, what I would say is, it is okay to be hesitant about getting the vaccine. Like, I just want to normalize, that it's okay. There are groups that, okay, I'm going to get it right away. And then there are groups who need more time. So the on the other hand, we're in an emergency. We're in a global pandemic that hasn't been seen, since the Spanish flu. And I'm here to tell you that I know vaccines work. An example of a disease we're able to totally eliminate because of vaccinations is smallpox. On the other hand, when we think about, sometimes people are like, I don't want to get vaccinated. Let's just wait for me to naturally get infected. A couple issues. One, when you get infected with COVID-19, it is killing people. Over 26 million Americans have gotten it. Over 400,000 people have died. I can't reliably predict who's going to die from the disease and who's not. So for me, waiting until natural infection occurs is going to be problematic. Lastly, to kind of hone in on your mistrust of the government, it's understandable, but so many strides have been taken to improve the quality of research. Dr. Colbert, Kim, Kismakia Colbert, excuse me for butchering her name, but she's a Black woman who was behind the Moderna vaccine. And so we're having representation in the people who have done the basic science behind the vaccine, as well as, representation in people who are actually doing the clinical trials and promoting the vaccine. So it's understandable. I'm going to tell you, just take your time and continue to have an open mind and open heart whenever regarding the vaccine.
So can I ask you this, Doctor?
Yes.
Dr. Byrd? Now, I would like to think I want to approach COVID as I approach everything, which is homeopathic. I eat right. I believe in bean soup. I believe in seeded watermelon. I believe in my leafy vegetables. I believe in exercise. So can I health food my way away from COVID and that be enough?
No, eating healthy is not going to prevent COVID-19 infection.
Melanin, that means nothing.
Well, I believe you're beautiful and melanated, and that's awesome. But eating healthy, living a healthy lifestyle will not prevent you from getting COVID.
Candace?
Yeah, and this is a perfect way to segue into that herd immunity in which you kind of spoke to, right? So I'm thinking from an educator standpoint, also a parent, right? Is that now for teachers who decide not to get the vaccine, but then we go back into the schools reopen, of course, they're going to have those precautions where you have to wear a face mask and so forth. What I thought perhaps this vaccine was supposed to do is to kind of create that herd immunity. Can you speak to that?
Yes. So, yes, perfect. So we want to get as many Americans vaccinated as quickly as possible. Let me back up. So herd immunity means that you have enough of the population either have natural infection or in this case immunized to protect the one or two people who are not vaccinated and or has never seen the disease. So that's what the herd immunity is. So regarding so that's what it is. So yes, that is still our goal, to get as many people vaccinated. And I think that that is a safer way as opposed to waiting for everyone to get infected, because unfortunately people are dying.
Hey, Donovan?
Thank you. Thank you for that.
Well, good evening. Thanks again, Dr. Byrd, for joining us on the show. Someone like myself, I'm skeptical about getting the COVID-19 vaccine because I've seen things on the internet where, people may have the facial palsy and terrible side effects from that. From your expertise standpoint, how likely is it that I may contract a side effect from taking the COVID-19 vaccine?
Perfect. Thank you for asking that question. So, the most common side effects from the vaccine is pain at the site that you get the vaccine, pain at injection site. So, it's not uncommon to have soreness there. Some people experience a low, like fever, body aches, headaches, fatigue. When you look at the clinical trials for the Pfizer vaccine and Moderna, those are the most common side effects people experience. But the majority of people didn't have any side effects after about 48 hours. Regarding the facial palsy, or Bell's palsy is what we call it, or seventh nerve palsy, that was described in a very few amount of cases. And that's something that is not permanent. It's something that goes away. It takes several weeks, but it will go away. The thing is, there were maybe like 4 cases that were reported, and in the Moderna trial, they had 30,000 over 30,000 participants, and in the Pfizer trial, they had over 40,000. So we're talking about relatively small numbers of people who had this adverse effect. So the majority of people do well. I personally had the Pfizer vaccine, and I experienced soreness in the arm and headache and a little bit of fatigue after the first shot. And after the second, I just had some soreness in my arm. So I personally didn't have that many side effects.
Well,
Yeah,
no, you got the shot. So
pardon me?
you received the shot about 2 weeks ago. Am I right, or a week ago?
About 2 weeks ago, yes.
So talk to me. How do you feel? How's your arm? Did you break out in a sweat? What happened?
I felt fine. I had slight soreness, and there's a little mark. But like yourself, I pride myself in taking care of myself. So my doctor said the minimal amount of side effects that I had, they were hardly negligible. And I want to be honest, because I have a younger son, and they just had a child, and so I would be honest about how I felt. I wouldn't try and hide anything. So I've been updating people on how I felt. And Dr. Byrd, I guess my question is, a lot of people wonder how there is a vaccine for COVID, but not for diseases like HIV, AIDS, cancer, and even the rhinoviruses that cause the common cold. Now, I know you've probably heard this, but could you explain how those pathogens are different and you really can't conflate the two?
Yes, so thank you. Let's just go one at a time. So for cancer, people use the general word cancer, but there are several different types of cancer. Cancer that, you get cancer of the skin, cancer of the tongue, cancer of the lungs, cancer of the colon, right? Each of these cancers can be triggered by a different thing. So for example, the most common cause of head and neck cancers is cigarette smoking. That's the most common trigger. So the issue with cancer is you have so many different factors that can promote cancerous growth in the body, as well as you have so many different types of cancers, and they all have different treatments. So it's really difficult to create one vaccine to eliminate all cancer. We do have one anti-cancer vaccine, and that is the HPV vaccine, the Gardasil. And so by getting that vaccine, that can prevent you from getting cancer related to HPV, or human papillomavirus. Regarding HIV, There are current vaccine trials against HIV that are ongoing. HIV is very tricky because it is a virus that incorporates itself into your genetic material. So that's tricky because you want to create a vaccine against the actual HIV virus and not anything else. But it's hard when the virus incorporates itself into your genetic material. Additionally, HIV is something that can rapidly change, and rapidly changing viruses can be challenging to make vaccines against it. And that's likely the case when it comes to rhinovirus. There are multiple types of rhinovirus. There are multiple types of viruses that causes the common cold.
Mhm.
So it's very difficult. And the one good thing about the coronavirus is relatively simple virus. We were able to look at its total, genetic sequence, which is basically the blueprint of what makes it tick, right? And able to quickly create a vaccine against one unique portion of the vaccine, which is a spike protein. And this spike protein is in all of the COVID-19 viruses. So that's what makes it a good, and it's relatively conserved, meaning it's not changing a lot. It's not changing as quickly. So you're able to create a vaccine against that. So that's why that's what makes it different, that COVID-19 has a conserved portion as opposed to the other vaccines. There are some other diseases like cancer, HIV, the common cold virus that makes it difficult to create a vaccine against.
Dr. Byrd, since you were talking about, you mentioned the newest variants.
Yeah.
All kinds of new variants of this COVID. So if we get the people that are getting the shot, are they protected from the new variants?
So Moderna and Pfizer have put out statements that they believe that their current vaccine will cover these new emerging variants. However, our new director of the CDC is working closely with these companies to create booster shots for any emerging variants. I'm not sure if we'll need to use a booster shot or if we'll need to get a repeat vaccine because it's changing so much, but that is what is currently happening. But that also when we're seeing more variants, that actually encourages us to try to vaccinate people as soon as possible. The less people who have not been infected, the less the chance the virus is going to infect people and start mutating. So you really want to I hope that made sense.
It did.
So you really want to try to decrease the number of viable candidates that the virus can infect. Why? When you do that, the virus doesn't have, it's something that infects humans. So it doesn't have as much chance to create mutations. The more the viruses have available people that they can infect, the more it's just going to change. And then our vaccines have a risk of being, obsolete. So that's another reason why we want to try to vaccinate people as soon as possible.
Now I have to bring up baseball legend Hank Aaron, who recently died. Will, you might want to ask this question because you're the baseball guy. You want to ask this question, Will?
No, because I kind of know the answer. Hank Aaron got the shot, and a little while afterwards, he passed away. And the rumor mill had it that it was from COVID.
The vaccine, yeah.
And some people were trying to say, well, the Fulton County medical examiners came out later and said it was from natural causes. But it's just hard to believe. If it was COVID, I just think they would have said it because there have been people. I just think they would have said it. They had nothing to hide from it.
See, I think they do, because every time you look at the TV, people are getting the shots, people are getting applause, they're getting balloons because they got the shot. Everything is about getting the shot. The push is everybody get the shot. So you have a high profile person like Hank Aaron, who looked healthy to me. When they stuck that shot in his arm, I saw a muscle. I was like, okay, Hank Aaron he still has it going on. He looked healthy to me, sitting in that wheelchair. So I don't understand what could have happened other than his body received something that it rejected.
Yeah.
That's me. I'm not a doctor. That's why we have Dr. Byrd here.
I think that,
please.
I think that
I am, by the way, Dr. Byrd, but we're going to ask you to wait around. Don't leave.
Yes. Okay. So this is actually a really good point. I do not believe that he died as a result of the vaccine. I think, unfortunately, it was an unfortunate coincidence. Just think, he was in his 80s. So, and we don't know his full medical history. I think I'm going to reserve judgment. I was reserving judgment until the medical examiner did their thing. It's just going to be really challenging, and we're going to continue to see cases like this, because when you're vaccinating people up front who are over 75, this, and you look at the average life expectancy of Americans, they're in this range where, we do see that they do pass it. It could be a variety of different things. But it doesn't sound like he had anaphylaxis. It doesn't sound like he had organs shut down. These are things that, just reading between the lines, that they did not mention. It doesn't seem like he had a heart attack. It doesn't seem like he had a stroke or any of these things.
I mean, I don't want to consider I'm not a professional, but someone like me would say, oh, he got that shot. That's what happened, period. I expect everyone to say, oh, that's not why. I expected that to happen. I didn't expect anyone to say, oh, yeah, by the way, he died because he got that shot. Because
I think it's
pro-shot now. Someone like me gets beat up because I don't want to take it.
No, I respect your opinion. I respect your feelings. I think it's really difficult. He was in his 80s. This is not somebody who got the shot and who was healthy in their 30s. So just, as the body ages, you have increased risk of, just breaking down or just dying of natural causes. And I think that was the case in this instance.
I know,
which is why I was so cautious. I mean, I'm 66. So conversely, listening to Leslie's argument, I read everything that I could. I was like sleepy reading because, you want to know. But I also looked at the number of people. I looked at all the clinical trials before they put it out. And I looked at all the people who had the shot. And as you stated earlier, the number of people that had the shot and nothing happened to them far outweighed the people who had the shot and they got illnesses. And I think that's the danger of social media sometimes. We can find whatever we want on social media to back up our feelings. That's not saying that we should not be cautious, but you have to look at the evidence as is and put it together. It's easy to get caught up in it's easy to get caught up in these things. It really is. I mean, all of you guys are infinitely younger than I am. So if anybody had worries about getting the shot, it was me, since Moses was my classmate.
Anyway.
Leslie, I wanted to check to see if we have time to share the reading tip before we have to.
Please. Okay. We have a wonderful segment to the Teachers Lounge Talk Show. We have Ms. Candace Williams from Irby Education, and she's going to give our reading tip for today, because remember, people, we are the Teachers Lounge. Please, Ms. Williams, please.
Yes, thank you. So today, this reading tip is brought to you today by Irby Education and Little Justice Leaders. So Little Justice Leaders is an amazing subscription website where they send you these awesome kits that you can create awesome books, and you do a lot of cool stuff. Okay, so it's a whole kit, but because it's Black History Month, I wanted to ensure that the reading tip that I share today will use a great piece of literature. And check this out. This is called The ABCs of Black History. Amazing book. But today's reading tip, it's all about the power of finger pointing. So a lot of people don't know the research-based strategy that finger pointing can support children in not omitting words, that means taking words out, or not inserting words that are not there. So oftentimes when you have a child read and they're just saying whatever they want, this is why it's important for them to track their reading. So this is a cool finger focus highlighter. And what it does is that it helps kids focus on the line as they read and they pass through. So I hope that you use this tip when your child is reading at home. Make sure they're using the power of finger pointing. Okay.
Beautiful. That is an excellent tip from Irby Education's Miss Candace Williams. Listen, we had a wonderful time here at the Teachers Lounge Talk Show. We thank you. We look forward to coming back to you in 2 weeks. Got that? 2 weeks, not next time. 2 weeks. And we are going to bring you more trending information for education. Thank you so much. We will see you in 2 weeks. Bye-bye.
Thank you, Dr. Byrd.
Thank you, Dr. Byrd.
Thanks.
Thank you, Dr.
Thank you
Byrd.
for having me.
Yeah. All right, we are back. I hope you enjoyed that commercial. Again, I forgot in my time because I was so excited about our guest. We did not thank Minister Malik Shabazz and the Get Up Stand Up Show. We did not shout out WHPR TV and the Mothership. Thank you so much for sharing your platform with the Teachers Lounge, for knowing that education matters and education is a topic that everyone is concerned with. So thank you for allowing us to have our voice. Thank you. We're going to continue our conversation with Dr. Katrina Byrd of Infectious Disease Control. Dr. Byrd, I believe I am an asymptomatic. I have no proof of that. I just believe I am. So because of that, I have it in my head that asymptomatics don't have to get the shot. Am I right?
We encourage all Americans to get this vaccine, regardless of if you've had symptoms or not, regardless of if you actually tested positive or not for the disease. So go ahead.
But see, if you get the shot and there's a reaction, I understand you can't even sue, like your family, your surviving family members, they can't even draw up a lawsuit to say, listen, wrongful death shouldn't have happened. Is that kind of hold your hand and makes you have to get the shot, and if something bad happens, oh well. That's what I'm hearing.
Well, I cannot speak about your litigation ability.
Okay.
However, this vaccine is not mandatory at this point. It is just something that we are offering. The federal government the FDA has approved this for emergency use authorization because we're in the middle of a pandemic. However, this is not a vaccine that you could be forced to get. This is something that requires your consent. And if you do not want the vaccine, then you don't have to get it at this point. So I just want to make that clear. If anyone is like, I really don't want to get it, then they shouldn't get it. Okay. We want people to get it freely. We want people to hear good information and facts and make their own mind up.
Yes. And, speaking to that, Dr. Byrd, so I saw in the news that Kroger was giving an incentive of $100 to its employees if they decide to get the vaccine. And just thinking about that and what you just said, I don't want us to go that route, right? Where we are giving incentives for people to go out and get the vaccine. What else do you think may encourage people to go out and get the vaccine? Not dangling a dollar sign in front of them or giving them a stipend, because there are even some school districts that are giving stipends out for educators who decide to go in person this spring here in Michigan.
I think overall, I love that I love that people are getting the vaccine. I do think it kind of skates the line with being paid to get the vaccine. And I don't think anyone should get paid to get the vaccine. They should be getting the vaccine because of their free will. And so it's kind of a tricky situation. I think that at this point, because it's an emergency situation, and I just want to stress, we're in an emergency situation that, you know, on one hand, I'm a little conflicted. On one hand, I'm happy people are getting vaccinated, but I don't like the fact that it kind of feels like people are getting paid to do so. However, if they feel that this is effective and this is a marketing strategy for their company, it's up to them. I can't make any judgment towards that.
I'll follow up with a question Leslie asked. Asymptomatic means you just don't have it yet, but you could get it, right?
Let's actually break that down. So someone who is feeling healthy, feeling well, they either do not have the virus or they have it and they are what we call asymptomatic. So the only way you're going to be able to tease that out is if you get tested for COVID. So if you get tested for COVID-19 and you test negative, you don't have it. You haven't been exposed, perfect. Well, I wouldn't say you haven't been exposed. You don't have the infection at that point in time. However, if you do get the test, COVID-19 test, and the test is positive, but you have no symptoms, that is what I would consider someone who's being asymptomatic infection. You are infected, but you aren't showing any symptoms.
Donovan, you want to throw your question in?
Yeah. All right. Once again, Dr. Byrd, thank you for joining us. As you know, me and Candace and Leslie are educators. What are your thoughts on the schools reopening, and when we reopen, should the staff be fully vaccinated?
So I think that the staff, just to answer the latter portion of your question, should be vaccinated as soon as the vaccine is available to them. I think that the schools should reopen. So you probably know this better than me. Doing virtual learning has been challenging on so many fronts. There are kids who don't really have a proper learning environment at home. Okay, they have a computer, they have internet, but there are multiple family members, household members coming in and out of the house to the point where they aren't able to learn. There are people who are on IEPs and who need services that they aren't adequately being able to get in the home. Additionally, we are seeing a psychological effect in children. We're seeing more depression, more people with kids with underlying psychological issues being exacerbated because they're unable to socialize and see other children. So because of all of these reasons, I do think that the schools should reopen as soon as it is safe.
Well, Dr. Byrd, I was, strolling Facebook, and I believe there was a school in upstate New York. I hope I have this right. They've been opened, and their parents continued to send their kids to school, even though they were sick. And an outbreak city in that school, and the parents continue. The school is still open. They have not shut the school down. It's one of those private schools. So should children get the vaccine? Because the fear is children are going to be among their classmates, and they're going to bring COVID home to their older parent, to their older grandparent, and then tragedy will happen. So should children also be vaccinated?
Children should be vaccinated. There are active clinical trials now that are enrolling children less than 16. So yes. However, I do want to make it clear that young children really don't transmit COVID-19 well. To be honest, when you're looking at especially elementary school children and younger, they are getting COVID-19 from adults in their close contacts with adults. So, and that's what the data shows. So in that situation, I would worry about the teacher actually giving the children COVID-19 as opposed to children giving the teacher COVID-19. And I think that's very counterintuitive, and your viewers are going to be like, what is she talking about? But when you look at multiple studies looking at transmission in young children, especially elementary school kids, they don't transmit COVID-19 well, not even to each other. There have been a handful of cases where they have transmitted to adult, but the vast majority of cases, it was an adult that gave it to the children.
And that's going into the whole like correlation and causation, because even with the contact sports, and they had a few outbreaks, and it was that, oh, they must have gotten it from each other. The kids are passing it around to each other. But going back to your point is that once they traced all of the people who had COVID, they realized that, oh, they actually got it from family members from home. Even out in West Bloomfield, where they had opened up the schools, it was a hybrid model where my kids, they went to school in the afternoon, stay home in the morning. And then there were like a few cases throughout the school district, maybe like 4 cases, but it wasn't like an outbreak within the school. And once they did the tracing, they found out that the students got it from their parents. So I understand, Dr. Byrd, the push for us to go out and get the vaccine. And to be honest with you, after this whole conversation, someone who was skeptical like myself, and my best friend, she actually works for the Oakland County Department of Health. She administers the vaccines, and she was nervous about getting the vaccine herself. And I said, well, how can you administer the vaccine when you don't even have it either? And it's the same dynamic, right? Is that going into the schools and you don't have the vaccine. So I really appreciate like lifting some of that weight off and the skepticism that I had. I feel a little bit more comfortable with the idea of getting the vaccine. What about you, Donnie?
Well, it's funny that you asked me that, because I'm going back into the building, and I believe the date isn't our start date the 25th, Leslie, after we have a winter break.
Yes.
Friday is our last day, and then we have all of next week off, and I believe we return on that Monday, which is the 25th, if I'm not mistaken. And I will be returning into the building to run a learning center. As I said, I'm a special education teacher, and like Dr. Byrd was saying, a lot of our students' environment isn't conducive to learning, regardless if we give them the tools that they need. So my students in particular were suffering because they already had a learning disability. The downside about it is I feel a lot like you, Leslie. I prefer to do the holistic thing, just because I have my fears and maybe not trusting the government with everything about the vaccine. And I'm still very apprehensive about it. And once things go along and I don't see my coworkers dropping dead or breaking out in hives, I guess I'll take myself on down and get the shot myself. But I'll be using the hand sanitizer, wearing my face mask, washing my hands frequently, and have my disinfectant spray, and just try to keep a clean environment.
But don't you have to be vaccinated to go back into the building?
No, I have to have a positive. I have to have a negative COVID test.
You just taught me something.
Still doing the 5? Is he still doing the looking to see if the infection rate goes below or above 5%? Isn't that BD's scale?
Yeah.
So,
I'm sorry. Go ahead. Sorry.
Candace, go ahead. Go ahead.
So
go ahead, Dr. Byrd. You're the guest. Go ahead, Dr. Byrd.
So I just want to thank you for your comment. I 100% agree that if you're not vaccinated or you're still contemplating, should I get the vaccine? I 100% agree with continuing to mask, continue to social distance, continue to wash your hands frequently, use hand sanitizer. I think that is the way to go. I know eating healthy, exercising, these things were mentioned earlier. You should do that just off principle because it's the good thing to do. But those things will not protect you from COVID-19. But wearing a face mask, social distancing, continuing to wash your hands will. So I strongly encourage everyone to continue to do those things, even after you get the vaccine.
I'll say this, Dr. Byrd, just listening to you and listening to how you speak on the vaccine, you do have me rethinking myself. And I will say that. I'm not totally sold on it, but I'm willing to do more research. Like when this show started, I was like, nope. Now I'm like, nah. I'm not, no. I'm like, nah. You know? So I appreciate this conversation because, there are a lot of people, not just in Detroit, in America, in the world, that feel like me. You don't want the shot, you want to do it naturally, you feel you just won't get it or whatever it is. And you're just going to mask up, glove up, bubble up, whatever. But I appreciate your words because it's definitely making someone that's intellectual like me think and rethink.
Mm-hmm.
So I appreciate what you said. I really do.
To be honest, I want to confess that I felt just like you. I initially, when I heard that they were making vaccines against COVID-19, I was extremely hesitant. My initial response was, I'm gonna just wait till everybody else get it and let me just see make sure they don't die. And then, then just, we'll see.
Still here.
But then, so that actually prompted me to do my own search, my own research. Look at the primary data, look at the clinical trials. How did they do it? Who did it? And kind of all these questions that you're asking me, I've already kind of looked into these things myself. And I am convinced that vaccination is the way in which we're going to fight and defeat this virus. And that's why I'm now moved from being very hesitant to get the vaccine to confident and advocate for the vaccination.
Just real quick, I'd like your opinion. What do you think? I would like to see, because children are afraid, young adults are afraid. I would like to see a curriculum. I don't want it to be hastily put together, and it would be on a scale, but I would like to see children be taught about diseases and pathogens and how people get sick and how they get infected. I would like, it doesn't seem out of the realm of possibility, and they should have this curriculum put together before school starts totally face-to-face to allay a lot of children's fears. Because, sometimes this information is not available to parents. And kids should know something about this because they hear all sorts of things. And I think that would be a good idea to educate children. Your thoughts?
No, I think that I 100% agree. Especially the young kids, I think it's really hard for young kids. They sense this fear with their caregivers, but they don't know what it is. And so there are some information resources out there, but I 100% agree. I think that would be helpful for all levels, K through 12.
Okay, one last question, Dr. Byrd. All right, so I see that you're wearing your red lipstick. I love my lipstick now too. And I'm just tired of wearing the mask. Now, I'm going to do it regardless, right? But when do you think we're going to reach a point where this whole mask wearing thing is no longer mandatory?
To be honest, when the majority of the U.S. population is vaccinated.
Oh, so y'all waiting on me, right?
I think that's where it is, and when the level of disease decreased significantly in the United States. We're still one of the leading countries in infection rates worldwide. So the combination of those two things, I think, will be predictive.
2022.
Yeah, I honestly have low hopes for 2021, to be honest.
Wow.
Wow. Okay.
Well, stubborn Americans, we want to get together at Super Bowl parties and we want to celebrate parades and we want to go out to eat. To me, I have no problem staying home. I have no problem cooking meals. I have no problem setting fires in my kitchen because I'm cooking meals. I have no problem with it. But like I said, Dr. Byrd, I appreciate everything you said today, because you educated me. And that's why I love this show. I love doing this show because I love it when I hear knowledge that I didn't know before, and then I could apply it to what I already know. So I am definitely going to rethink my stance on the COVID. I'm going to educate myself. And I have you to thank for it, Dr. Byrd, because really I was convinced an hour ago. I was like, I ain't getting that. I ain't getting that. Now I am more thinking I'm going to look into it and make the best decision for not just for me, but for my family and for my country. So that's where I'm thinking now. And I want to thank you for that.
Oh no, thank you. So that actually warms my heart. So thank you, you know.
We have 1 minute left. So we're going to go down. We're going to get final thoughts. We're going to start with you, Candace, Donovan, Will, and we're going to end up with Dr. Byrd. Okay. So Candace, final thought?
My final thought is simply that it's not mandatory, but it's needed. It's needed for us to get vaccine, to get our vaccinations, and then also thinking for my children and everyone else's kids out there. As an educator, we want to make the society as safe as possible. So, Dr. Byrd, I went from being on the fence to thinking that I should go ahead and make that appointment. You know?
Yeah, Donnie.
Yes. Once again, thank you, Dr. Byrd, for coming on. I'm still very apprehensive about it, but you did lay out some great points, and it's definitely getting the gears turning in my head. And I may consider getting it because I work around children, but I'm stubborn. So as of now, my position is still the holistic thing. But thank you for sharing your knowledge and making me feel a little bit less apprehensive about getting it.
Will, final
Well,
thought?
knowledge is power. And Dr. Byrd, you gave us a lot of knowledge tonight. So anyone out there listening, you heard it here first from Dr. Byrd.
Dr. Byrd, please, final thought.
Thank you for having me on the show. Thank you for, you kind of relaying your fears in regards to the vaccine. It is 100% okay to be hesitant and to be thoughtful. But at the end of the day, I really do think that vaccinating the American people will be the way in which we're going to end this pandemic.
I love it. And what I'm trying to do, Dr. Byrd, what we didn't do, and I said that we would, and because I'm remembering it, I'm doing it now. We have like 30 seconds. You want to tell us about your beautiful website?
Oh,
I'm
yes.
pulling it up now. All right, bam. Look at this beautiful website.
Yeah, so I created a website to I do a lot of teaching online. I not only talk about the COVID-19 vaccine, but I'm doing a STI, like a sexually transmitted disease series. I talk about different things. So this is a little bit about me, what I do. I have blog posts. I also do a lot of teaching on Instagram and YouTube. So this is just another source of information for you and ways in which you can reach out and connect to me. So it's katrinabyrd.com, and at the top right hand corner are all my social media links, so you can contact me through social media, or at the bottom there's a contact page. So I would love to answer any questions that weren't asked on this segment, or if you would like for me to talk to your group about the COVID-19 vaccine, I'm more than happy to do that.
Dr. Byrd, we of course want to have you back.
Oh, no problem.
Please, this has been so wonderful. Let me take down my protest picture. All right, this has been so wonderful. We went a little over, but we're okay. Thank you so much, Dr. Byrd. Thank you so much, hosts. This has been a wonderful episode of the Teachers Lounge Talk Show. I've learned so much. I pray you did too. We will be back next week. Thank you so much. We will see you next week here on the Teachers Lounge. Bye-bye. Thank you.